Hi, my name is Alana Patrick, and I'm going to be doing a musculoskeletal exam on my patient today. Um, First, I would begin with, as my patient walked in, I would examine his gait, posture, ability to walk, which all, for this purpose, are normal. Um, then I would move on to I'll start with my patient's hands, the joints. You can inspect for symmetry, any signs of swelling, which I don't see. And then you can palpate the joint of each finger, and then as well as the wrist bilaterally. Just hold your hands out. Sir, do you feel any tenderness when I touch? I'm not feeling any deformities with his joints or any crepitus or swelling. Does it hurt when I touch it, sir? They appear symmetrical, both of his hands. One thing that I would check for with my patient would be for carpal tunnel, and there's a few different tests you can do for that. One is the Fallon test. Sir, what I'm going to have you do is just kind of put your hands together like this, bending your wrist. Does that hurt or feel numb or tingly at all? This way? Okay. And then also there's the Tennel sign, which I'll have my patient have his palms up, and then I just kind of tap here where the medial nerve is. Sir, do you feel any tingly or numbing type of sensation when I do that?
No.
And check it here.
No.
Neither? Okay. And then I'll test his grip strength. You squeeze my fingers, sir. Very good. Checking the strength in his thumbs. Sir, I'm going to push down on your thumb, but you try to push up and don't let me push down, okay? Does that hurt? Did you have any injury to your hand lately?
Yes.
What happened?
I jammed my thumb.
Okay. Were you playing sports or anything? Did you? Okay. How long ago did that happen?
2 weeks ago.
Okay. So for this instance, that would be something to further investigate with my patient. I may need to get an x-ray. There may be something broken, or it may be the beginning signs of some type of joint disorder, such as gout, or some type of arthritis. I'm going to check this thumb as well, sir. Okay. And so with this thumb, it's normal. So since he doesn't have bilateral weakness and tenderness, I would assume that the pain and tenderness comes from the injury, but it would certainly be something to further investigate. So moving from my patient's hands and wrists, I'll move on to the elbow, which I'll visually inspect on each, which they seem to be very normal and strong. Sir, I'm just going to have you, well, I'm going to do it first. I'm just going to move your elbow back and forth. Does that hurt at all, sir?
No.
Do this. So we're just checking for range of motion as well as strength, and I'm palpating the surrounding muscles as well as the joint for any crepitus, which I don't feel. I'm just gonna flex it. Any pain there, sir?
No.
Okay. So from the elbows, we move upwards to the shoulders, rotator cuff. Can you shrug your shoulders up for me? Perfectly. He has good strength against pressure. And as I palpate the shoulders, the trapezius, bicep muscles, is there any pain or tenderness there, sir?
No.
Okay. And so I'm going to take your arm, bend it up, Does that hurt?
No.
Okay. Out. Any pain there?
No.
Okay. Does that hurt at all?
No.
Nor do I hear or feel any crepitus with these motions, these passive range of motions. No pain there as well? Okay. I would do the same, my patient's knees as well as ankles, as well as with a reflex hammer I would check for reflexes, which for all intents and purposes my patients are normal. The final thing, would you stand up for me, sir? Would be to check our cervical and thoracic spine. Can you turn around for me, please? Which my patient's spinal column is in line. There doesn't appear to be any deviation. Are you able to bend at your hips and reach for your, you don't necessarily have to touch your toes, but just kind of reach down as if you're touching your toes. And as you can see, it's perfectly symmetrical and in line with his spinal column. Sir, can you tilt your head to the left and to the right? Tell me how that feels. And then look down and up your neck. I don't palpate any crepitus. Everything looks normally in line. Do you have any pain or tenderness, sir? Okay. All right, you can have a seat. And that completes my musculoskeletal exam. Thank you very much.